So I'm going to talk to you about a very sad illness, which is cancer, and more specific about the quality of life of cancer patients, which I call cancer supportive care. I want to show you a video that gives you the feeling what cancer supportive care means.
Every single day is precious for people with cancer. But treatment side effects can destroy the quality of their daily lives. Simple things like a coffee with friends, a walk in the park, or making a fairy costume can become unbearable. But one cancer care company is on a mission to improve the quality of life for all those affected by cancer. As well as developing innovative treatments to ease suffering from conditions like chemotherapy-induced nausea and vomiting, they are actively finding solutions for some of the most devastating side effects of cancer, such as cachexia, for which there is a real unmet need. And going forward, they are totally committed to building better todays for people with cancer.
So this is really a situation which many patients and families are experiencing when they have somebody with cancer. And this has inspired me also in the last 10 years of my business life. And this started mainly because a very bad situation that I live with my best friends, Rocco Magnoli, which was one of the famous architects in Milan. He built houses, he built a church, even mosques around the world. But then he got into multiple myeloma and was very treated in the best center of the world in Little Rock, Arkansas. But then he died. And what is even worse, the last 2 years of his life, he suffered all the worst things relating to cancer, many side effects. And so I get involved from that moment on in new research in how to improve the quality of life of cancer patients. But let's talk a little bit about what is cancer. Cancer is been said by CNNS as the imminent disaster. It's now the second cause of death. We have 8.2 million deaths in 2012, and unfortunately will increase in the next 2 decades by 57%. This is mainly due to bad habits, and like smoke, like alcohol, like overweight, bad use, generally speaking. And this can be done, something seriously can be done, also because it's a big cost for the society, or almost more than $1 trillion in 2010. But cancer has also not just been an illness of the development world, so the Western world. Recently, new data coming out from the WHO report say that 60% now of the cancer cases coming from new emerging countries, Africa, Asia, Latin America, and 70% of the new death cases comes from this region. So it's a worldwide problem. There is a good news in cancer, although. Due to the last years of therapies, so chemotherapy, antibodies, and hormone therapies, the expected life at 5 years has been improved from 49% in the 70s to more than 78% recently. And in certain kind of cancer, these kind of things have been improved substantially, up to 80%, 9%, and even 100% in prostate cancer. So it's a good news, but, and there is a but, this is what happened with people that have cancer, and what they are treating by cancer is a lot of side effects. And you can see here, there is a quite list of pain, cachexias, anorexia, nausea, vomiting, mucositis, diarrhea. So a lot of bad situation where people have to live for many years, because now you can live with cancer 5, 6, 10, 15 years. And these things doesn't go away. So I've been developed many pharmaceutical products in this area, but I also think about new concept. And the concept is really cancer supportive care, which really allows to manage these side effects, to really improve the quality of life, keeping patients on track with their chemotherapy treatments, and at the end also will help to improve the quality of life and living better. But I think that one of the most important things that I discovered along this period of research and investment is to put the patients in the center of our focus. Patient is not just a body where you have to prescribe a pill or an injection. It's something more. It's an individual. So you have to focus him in the center and try to give the best available resources, which of course are pharmaceutical treatment, but could be also other kind of things like food supplements, informations, medical food, medical devices, and also alternative medicine like Chinese medicines. So I start to have a new approach, a quality approach with cancer patients, trying to see, in here you see in this chart, really to see all the aspects, from cancer therapy to cancer supportive care, to food supplements, Chinese medicine, and interact with the player, with really the stakeholders that are in this area, which of course is the physician and the carers, also nurses, in one side. On the other side, there is the insurance, the governments, which pay for this treatment. But in the middle, which is very important, is patients. And I add on families, because family strongly support and strongly are being affected by this situation. And interact with that, I think new technologies like mHealth could help to interact between suppliers and stakeholders. So, looking at new things, a part of drugs and pharmaceutical, what we can do for cancer patients. We can really develop new lines of food supplements. We can have medical food. We can have medical devices, healthcare platforms, what is called IT health, which is very important to deliver information and support patients. Chinese medicine, alternative medicines. Everything is very important to all these aspects. So starting talking about food supplements, I think food supplement is something that everybody of us take on the normal life. When we do sports, when we do normal lives, we take vitamins, we take amino acids, and this is normal. But then when you became a cancer patient, then you are afraid that this product interact with your therapies, that this can somehow impact on that maybe the production is done in some strange countries with no quality. And so then it's a problem. So I thought that a new investment there was needed. So I did a new startup in this area to provide to patients new lines of product, very well known, but high quality, and tested in cancer patients. So this was the first support to go on. The second area, which I think is very important due to the new technologies, is medical device. There are now new emerging medical device, in which some of them I've invested as a startups, is technology, a medical device that helps to treat cancer. Our complementary use are definitely less invasive than drugs or other surgery, and could help patients to live better and live longer. But there are something else also, and I think is the new instrument, the new technology, is IT health. Or you can call today also mHealth, mobile health, or uHealth, ubiquity health. So you can get health any part of the world throughout your smartphones. Now 75% of the population around the world has a smartphone, and through that you can deliver information, the most close doctor, the most close hospital, where treaters are available, what are the prices of that. So it's really the most important things. I recently supported new developments in this area, the American Association of Oncology, with this important project for all humanity, which is CancerLink, will be the biggest database in the world that will really put in all the information about each single patient with cancer, any single treatment by doctors, to elaborate all the data, to analyze them, and then give back to the patients, to the doctor, potential solution based on really evidence-based medicine, which is really what the people want. Transparent, clear data, and not managed by some strange people. That's really get through, and this will be available in the next few years. I also did something else. I invested recently in a startup company, really to put in contact patients and doctors to allow them to have a direct link, although they are maybe in contact with normal prescriptions, but they have no time to stand together and have information. So this portal will allow each single patient to have more information about their illness, about their data, and what is more important, they will own this data and then can share with different additional doctors or healthcare professionals. So this is mHealth, which I believe is a very strong potential tools to support, of course, as I mentioned, drugs, but to support also food supplements and medical device. Another area which I think is very important, and I also invest here in a startup about 7 years ago, is the area of complementary medicines. I don't like to call it alternative medicine because this area could really work very well together with the Western medicine. Complementary medicine is many different medicine, can be the Indians, can be others, but what I'm talking about here is more about Chinese medicine, which is a long lasting experience, more than 5,000 years ago. And in this specific case, Chinese medicine can take a lot of advantages with their herbal treatments to do a lot of activities. For instance, Chinese medicine can really enhance the activities of the chemotherapy, can also help to reduce the side effects, and in many cases help the quality of life of patients. So this is an area where I invested, and I make some invested here in Switzerland, based on the concept of these 3 kanji, which means the center of the value of life, which is very important to focus patients on the value of life. So also here to put the patients in the center, high quality treatment of Chinese medicine, which is herbal medicine, but also acupuncture, performed by Western doctor trained in China or Chinese doctor that come from China and working here. This is being added, of course, to different illness, but also applied to cancer patients to reduce their symptoms, their pain, their nausea, their vomiting, their diarrhea, a lot of symptoms which they will taking with them for the rest of their lives. And I think this is another area where I really strongly believe could be a value added on all these aspects. So, concluding, I think that it's very important, and this has been my experience in the last 10 years, from a typical pharmaceutical entrepreneur to go more wider and see and putting the patients into focus, which means to put really the focus of the body of a person and the human being. And so looking at how can we improve the quality of life of these patients, how we can improve the success of the therapies, how we can improve really his behavior and staying with the treatments. And so at the end, improving and prolonging his life in a better way. And this is an important thing because getting older, the difference between healthy people and patients is just a question of time. And so we have to know that and investing better in this area. And what I always see, and I want to tell to all people that I met, we have to see people before patients. Thank you very much.